The Division of Surgical Sciences was created as a home for our researchers who conduct basic and translational research. The work of the division is both in the area of basic discovery, but also in the area of commercialization and bringing discovery to patients through innovations, new drugs, new devices, new techniques.
Washington University has a tremendous history of scientific discovery. Our Department of Surgery has been in the forefront of multiple discoveries in the past. We were among the first to do a heart-lung transplant. We were the first to do a laparoscopic nephrectomy. And it's these types of innovations in surgical care that have impacted the lives of millions of individuals. I'd like us to imagine a world where we can make discoveries in the research laboratory, be able to then study them, come up with new solutions, and then be able to seamlessly integrate them into our clinical practice via collaborations with commercialization partners as well as industry partners.
I take care of patients with pancreas cancer, and I also run a research lab where we focus on strategies to train the immune system to enhance body's ability to fight cancer. Pancreas cancer is known for its resistance to conventional treatment options, but immunotherapeutics have shown promise. One area that we are focusing on is personalized pancreas cancer vaccines, which allow us to tailor the treatment to patients' unique genetic makeup.
Traditionally, we have, in academic medicine and surgery, have focused on things like publications, discoveries, grants. But now we realize that what's really important to patients, both now and in the future, is our ability to bring those discoveries and innovations to their care. And to do that, we have to, in some way, bring business into this endeavor. A drug is not developed without a company. A device is not developed without a patent.
For that, we need to be able to find better ways to collaborate and commercialize our ideas.
The Division of Surgical Sciences offers a platform for mentorship programs and facilitated networking opportunities for junior faculty members. They have resources allocated for various research endeavors.
Advances that patients now enjoy were made by surgeon scientists back 5, 10, 20, 30 years. So one aspect of the Division of Surgical Sciences that needs to be emphasized is the education mission of future surgeon scientists. Our residents and fellows, and indeed our students, will be educated to carry on the next generation of work in the Division of Surgical Sciences. So investment in the DSS is an investment in the talent that will bring our future forward.
Through my time thus far as a research resident, I've been able to do a lot of work supported by the Division of Surgical Sciences, contributing to the development of new therapies for treatment of cardiovascular disease. Some of them that I'm working on is a concept for an arteriovenous graft that you put islet cells into and then can essentially start to treat somebody and maybe even cure them of their diabetes without needing to do immunosuppression. We're in our early in vivo testing, but the kind of extent to that we can do that here is really exceptional.
When I'm able to help a patient either restore their livelihood, their function, their ability to care for the loved ones, that is by far the most rewarding thing that I do. One of the things that keeps me going, though, is my curiosity on how we make it better and be able to then try to take these observations and discoveries hopefully back to the clinic and back to the patient.
The impact of this work could be transformative. Personalized approaches allow us to target each individual's cancer at its core.
If there's interventions that are going to be better for patients, lead us to better outcomes, have people get home with their families quicker, that's what I want to be a part of.
Ultimately, the Division of Surgical Sciences is not just about advancing research. It's about improving lives, redefining what's possible in surgery, and shaping the future of healthcare.
The discoveries we make, when brought to market, will employ our neighbors, will fuel business in our area. The tools we bring to bear on human disease will touch patients, not just in our region, not just in our state, not just in our country, but worldwide.